Well, again, thank you to everyone who's joined us today for this first session of our North Central Farm and Ranch Stress Assistance Center webinar series. My name is Paul Jones. I'm the manager of the National AgrAbility Project, and our program is charged with providing quarterly webinars for this particular project. And our first one is going to be an overview of the USDA NIFA Farm and Ranch Stress Assistance Network, and we're going to be focusing on the North Central region, which is the sponsor for this particular series. Our presenters today include Brent Elrod, who is the USDA NIFA National Program Leader for the FRSAN grant, and also Josie, Rudolphi, and Courtney Cuthbertson from the University of Illinois at Urbana-Champaign, who are the directors of the North Central Project. I mentioned that AgrAbility is the provider of the webinars in this series. Some of you may not be familiar with AgrAbility. We are also sponsored by USDA NIFA, and our focus is on assisting people in agriculture that have some type of disability or functional limitation. Every one of the AgrAbility projects around the country is a partnership between a land-grant university and at least one nonprofit disability services organization. And there are currently 20 different projects around the country in addition to the National AgrAbility Project. Here at Purdue, we lead the National AgrAbility Project, and our partners on that grant include Goodwill of the Finger Lakes, the Osteoarthritis Action Alliance, Colorado State University, and Washington State University. If you'd like more information about AgrAbility, please feel free to go to the agrability.org website. We have a wealth of information there, including over 90 archived webinars on a variety of topics. At this point, I'm going to turn things over to Brent Elrod. Again, he is the USDA NIFA National Program Leader for the Farm and Ranch Stress Assistance Network, and he will give the body of this part of the webinar.
Thank you, Paul, and greetings to our attendees. It looks like we're approaching 50 that are online for the live broadcast. I'd like to thank my co-presenters, and I'd like to thank all the folks from AgrAbility, the state reps, their partners that are participating today on this very, very important topic. Hopefully everybody had a relaxing and safe holiday, however you chose to market this year during the global pandemic. Certainly challenges for us as individuals and family members within our communities, but certainly enhanced stress associated for our producers this year as they had to make decisions early related to just about anything related to our food supply and all the ramifications associated with that. So we know that the pandemic is going to continue to be with us here, and that's certainly one issue. But we know there's multiple stressors that agricultural producers face, and the reason that we have stood up the Farm and Ranch Stress Assistance Network, and will be continuing to do so over the next 3 years and hopefully beyond. Just going to start out with information that many of you are certainly alert to and know. Just a few notations, and I'm not going to read these to you. You can read them as quickly as I could say them, and then it'll allow me a little more time to talk about the actual network and the services that we're going to be providing in response to some of these challenges. As you can see there, we have some of these based upon the timing. Since 2013, reduction in net farm income has been pretty steady during that time, and so these challenges aren't new, they aren't going away, and so as a result, it's important for all of us to identify our roles and take responsibility for being part of the solution. Here's some of the additional literature review that some of my colleagues have helped to lead and capture. You know, and I think that second bullet is one that is especially of note for those of you that are working within AgrAbility, because you are alert to these. But when we try to get producers to uptake new technology products, institute new policies, those that have poor mental health, it's been demonstrated, are less likely to do so. And so part of our role, again, is to ensure that producers are getting access to the resources and supports that they need so that their mental health is strong, that they can make good choices about their production activities going forward. Some additional challenges here, and this is that top bullet here. Part of the reason that the Farm and Ranch Stress Assistance Networking has been stood up, we know that any producer or family member that takes their life is one too many, but there have been multiple over this year and beyond, and it points to the immediate and pressing need for us to be able to get those supports and resources in place, especially in areas where they may not be readily available and prevalent. We also know that there is a general stigma associated with seeking help for a challenge, and especially we've seen that time and time again in rural communities where the mentality is, I ought to be able to do this and, pull myself up from my bootstraps. And yet the challenges there that we have noted on the previous slide and a couple of the others there that I've included here with the bullets on this slide point to how those challenges can be overwhelming at times. And when you add them all together and over multiple years, how difficult it can be for those that even have the strongest mental health to be able to potentially go forward. So that's part of the reason then that we have been looking at ways that the federal agency on behalf of U.S. Department of Agriculture, federal government partners, our land-grant universities, the Cooperative Extension Service can all be part of the solution. And so what I've captured here on the slide are just a couple of examples that I wanted to point to. So it's back in about 2009 that we at NIFA stood up the CAPE project. You see it there, Community Assessment Education to Remote Behavioral Health Planning. And we did that in conjunction with the North Central Regional Center for Rural Development, housed at Michigan State University at the time, to kind of look at what the behavioral health responses could be in communities to meet the needs in their particular community. And so that toolkit continues to rest at the linked website. So when you have access to the slides, these are hyperlinks that you can follow to gather that information. Related to that, we've also stood up an Extension Opioid Crisis Response Work Group, and that's led to the development of a National Behavioral Health Extension Network that is housed at Iowa State University. In addition, we worked with our colleagues at the Farm Service Agency to develop a training and technical assistance program that supports their field staff. Again, some of our presenters that are on today have assisted with the development of that curriculum and led that particular training, developed as a pilot for FSA field staff to gain a better understanding of what they can do to support their own mental health well-being, but then how to potentially respond if a producer comes into one of those field offices and indicates that they're having some particular challenge, and how to connect them with the resources and support that might be helpful to them. So that pilot was very successful and has also led to the development of online training modules that are now in final review for being pushed out across USDA's online learning platform, so that any USDA employee would be able to access these modules and increase their own understanding of ways that they can be part of the solution. Related, we've also, as you are hearing today, stood up the Farm and Ranch Stress Assistance Network. This next slide will tell you that the legislative authority came originally from the 2008 Farm Bill. At that time, and you see what the legislative authority provides, however, no funding was provided to actually move forward with the development of the network. Instead, some of our land-grant universities, Cooperative Extension Service, non-governmental organizations stepped up into the space to be able to provide state and local responses to the challenges that, if you can do the math back to 2008 when we had the Great Recession and some of these same challenges we were seeing with farms closing, and again, issues related to harm to self that were arising. So with the 2018 Farm Bill, Congress allocated initial funding to launch the network, and you see the program purpose there to establish a network that connects individuals who are engaged in farming, ranching, and other ag-related occupations to stress assistance programs. And they're also that the definition for farmer is really the broadest it possibly can be. We want to make sure that anyone that is engaged in food and agricultural production has access to these services and supports, again, so that they can continue to be productive, whatever their role might be in supporting our food supply. With the 2018 Farm Bill, Congress allocated an initial $2 million appropriation to support. Basically what we did was a SWOT analysis to kind of see what already existed, where the gaps were, and then that led to the development of a request for application for us to go out to bid this past year in fiscal year 20 to formally stand up the regions across the United States so that we cover all states and territories and that we give these regions time to develop, because we know there's strength in some areas, there's big gaps in others, and we wanted to be able to build on the strengths and be able to address some of those gaps over that length of time. These are key components that are required of all the regions, again, so that we can be consistent in terms of ensuring that we're offering a wide array of services. You see telephone helplines and websites, dedicated training, of which this webinar series is one, support groups at the local and regional level, and then also outreach services and activities, including the dissemination of what we hope are evidence-based materials that are developed. The goal is that as we increase our own learning about what works, how to successfully engage producers and their family members, connect them with the services and supports, so that we can ensure that that information is shared widely across the region. So something that's developed in the North Central region that shows promise, we could also then quickly get out to our colleagues that are leading the efforts in the other regions. Here then are the award winners for the fiscal years 20 to 22, and again, they're getting started now at the University of Tennessee in the southern region with the Washington State University-led effort for the West region. And then our partners at the National Young Farmers Coalition in the Northeast region, and then who you're going to hear from here in terms of leading the North Central region, Josie Rudolphi and Courtney Cuthbertson. So I would like to hand it off to them, and I'll stay on and be available for questions as they're added to the chat and or when we open it up for formal Q&A at the end.
Okay, at this point I'm going to turn things over to Courtney and Josie.
Great. Well, thank you so much. I'm Courtney Cuthbertson, and I'm an assistant professor and extension specialist in the Department of Human Development and Family Studies at the University of Illinois. And Josie?
Hi, I'm Josie Rudolphi. I am an assistant professor and extension specialist in the Department of Agricultural and Biological Engineering, also at the University of Illinois.
And we are really excited to share with you today about the North Central region effort that we have called the North Central Farm and Ranch Stress Assistance Center, engaging programs to produce programs to support producer well-being. Effective in September of this year, Josie and I are leading this effort from the University of Illinois. The 2019 effort for the Farm and Ranch Stress Assistance Network was led by David Brown at Iowa State University. So just for some context to begin, this is the North Central region highlighted in dark blue here. It's a large area within the middle of the country containing 12 states, starting with Ohio in the east and going out west to Kansas and up north through the Dakotas. We have 15 different key network collaborators that represent all of those states in the North Central region. Our key network collaborators include Cooperative Extension in all of those states, as well as the Central States Center for Agricultural Safety and Health, the Progressive Agriculture Foundation, and National AgrAbility. And each of these key network collaborators brings with them their own networks within their own states, including connections with the Departments of Agriculture, state farm bureaus, farm credit services, commodity groups, behavioral health providers, and so on. Within the North Central region, we have over 500,000 producers, or nearly 1/3 of those producers in the entire country. The majority of producers in the North Central region are male and are white, and about 1 in 9 is a military veteran. The average age of a North Central producer is just over 52, and about half have a primary occupation outside of farming. You can see the top 5 commodities listed there within our North Central region as corn, soybeans, cattle, hogs, and dairy, although the North Central region also includes states that are the top producers of other commodities, things like pumpkins, blueberries, and tart cherries. The landscape of agriculture in the North Central region is diverse. Farm workers are an important part of agriculture in the U.S. as well as within the North Central region specifically, and in the North Central region there are approximately 300,000 farm workers. Like other regions, the North Central region has experienced extreme weather events in the past 3 years that have made large impacts on agriculture. These include water-related issues such as drought, or on the other side of things, heavy rain and flooding, as well as late blizzards and wildfires. It's important to note these things because weather is one of the most consistently cited stressors for producers, especially because it is outside of any one person's control. And when we look at mental health indicators among producers, the overall picture that we get is that mental health is worse among those engaged in agriculture than among the general population. Unfortunately, there are limited to no studies that are truly representative of all of the people who work in agriculture. But the available data that we do have show an interesting and alarming picture. Various studies available show the prevalence of anxiety between 27 to 71%. And I have a range here. These are studies that used a validated instrument for generalized anxiety disorder, which among the general population is at about 2.7%. But when we broaden to all anxiety disorders, the general population is about 18.1% for anxiety, and still among producers it's quite a bit higher. It's a similar story when we look at depression. Among the general population, just over 7% experience major depressive disorder, and when we look at studies of agricultural producers, the prevalence of depression has been between 9% and over 58%. So again, it's alarming that these numbers seem so different. There's also some and mixed evidence of higher suicide rates among producers than the general population, and you can see the slide lists some of those, up to 1.5 times higher among primary producers and 1.15 times higher among agricultural workers compared to those who are not in agriculture. Substance use is also higher among people who work in agriculture than other workers. And we've got the indicator for heavy alcohol use on the screens. It's slightly higher among those in the agriculture industry than other full-time workers. There are additional substance use indicators like illicit drug use, which is over twice as high among agricultural producers at 5.7% than the general population, which is under 3%. Substance use disorders are higher as well. 10.5% of producers experience a substance use disorder compared to under 8% in the general population. A lot of questions have come up, especially in the past few years, about opioid misuse and opioid addiction. And an American Farm Bureau study from 2017 reported that nearly 3/4 of farmers and farm workers were impacted by opioid misuse, whether that meant themselves experiencing opioid addiction or opioid misuse, or whether it was someone that they knew within their family or within the community. Within the lenses of diseases of despair, behavioral health outcomes such as depression, anxiety, suicide, and substance use are seen as indicators of underlying hopelessness and stress. So at this point, we turn to what are those things that can influence stress, and what are the several ways that stress can impact producers and their families as well as agriculture. We've heard a little bit about this already. Uncontrollable events such as weather, like I referenced earlier, can impact stress, and individuals may be at increased risk of mental health conditions due to a variety of factors, including things like education level, such as gender, the authority one has to make decisions, one's legal status, and a sense of self-efficacy or mastery, or in other words, a sense that one has control over their life. Stress can impact a variety of areas as well, including the things you see listed on the slide here: family relationships. Studies of farm families have shown that when parents in a farm family experience stress, the youth do as well, and it can come out in ways like engaging in unsafe practices on the farm. Stressors can exacerbate existing mental health conditions, and substance use could be one mechanism that people use to try to cope. Physical health can be impacted with stress as well, where a person may be more prone to getting sick, getting colds, experiencing aches and pains, digestive problems, and circulation problems such as blood pressure. And generally, we know that unresolved chronic stress over a longer time frame can lead to some pretty severe outcomes for people. It may lead to premature death due to suicide or chronic health conditions such as heart disease. And even before that point, stress can impact the agricultural setting, as higher depressive symptoms are associated with higher numbers of accidents in farm work settings. And in general, mental health issues are associated with people missing work or being less effective when working, and having a reduced quality of life. It can be incredibly challenging when people are experiencing mental health issues to think about how to get help. How can someone access a mental health provider to provide assistance when someone's really struggling? There are 4 or 5 key things to consider related to mental health care: availability, accessibility, affordability, acceptability, and stigma. So there are a number of questions that can help us to assess each of these. First, are there even mental health providers available within the geographic area where one lives? How far does someone have to drive or take transportation to be able to reach someone? Accessibility right now during the pandemic could also look like, what are the telehealth options that are available? And does someone have reliable enough internet service to be able to engage in a telehealth visit, or would they be able to use the phone for such services? Under affordability, things like, how much do the services cost? Does the person have health insurance that would cover the cost of those things? And within the ideas of acceptability and stigma, do providers know or understand the context of agriculture to the point where they are able to serve producers well? And then what ideas and beliefs do people within the agricultural community hold that might serve as barriers to one seeking care? So just as an example, this may be a map you're familiar with. You can see the map here is the map of mental health professional shortage areas, a federal designation made at the county level indicating that there are not enough mental health providers. The majority of counties in the North Central region, and indeed if you look at the map across the country, are mental health professional shortage areas. This means that even when someone wants to seek help, that help may not be available. It might be very far. It might take quite a while to schedule. And what's notable about this is it makes opportunities such as the Farm and Ranch Stress Assistance Network all the more important, because we are engaging with communities to figure out new educational programs, to establish an evidence base for those, things that can promote well-being, connection, things that can address stressors and improve opportunities and access to care, and improve the supportive network of people around producers. So I'll turn it over now to Josie to talk about our specific North Central efforts.
Thank you, Courtney. Did the slide move forward?
Yes.
Okay, great. Thanks, Courtney. As Brent and Courtney mentioned, they really underscored the need for this work nationwide and in the North Central region. In response, with support from USDA, we've established the North Central Farm and Ranch Stress Assistance Center. And this center will serve as a collaborative mechanism to streamline activities, to more widely publicize opportunities to producers and stakeholders, to develop new resources and grow partnerships, all with the goal of supporting mental health for our agricultural producers. As a center, we have convened 15 key network collaborators, each with their own farm stress initiative. These state efforts complement center-wide activities to expand and create stress management and mental health resources for agricultural producers in the North Central region. All of these initiatives align with key components as outlined by the program's RFA and mentioned previously by Brent. They include training programs, telephone, helplines, and websites, support groups, and providing access to professional behavioral health interventions. Key Network collaborators are offering a variety of training programs for agricultural producers and agricultural stakeholders. Training programs include mental health first aid and QPR, as well as farm stress workshops developed by Michigan State University Extension. MSU workshops provide research-based education on the various sources of stress for producers, communication strategies, and how to refer a producer to mental health resources, including when a producer might be considering suicide. Already, extension educators across the North Central region, and we know beyond, have been trained to deliver the MSU program, and the North Central Farm and Ranch Stress Assistance Center will support another 100 trainers. We really believe in the power of these training programs. MSU has done a really great job of evaluating them, and we feel like they are really going to be useful not only for producers, but also for the people who surround producers both personally and professionally. The North Central Farm and Ranch Stress Assistance Center is supporting the Iowa Concern Hotline as a telephone helpline for producers in our region. This is supported by Iowa State University Extension and Outreach. In the Iowa Concern Hotline, trained specialists provide immediate support to assist a caller or connect the caller with an expert to provide needed help. The Iowa Concern Hotline provides stress counseling for callers in distress, but can also provide legal education, discuss financial concerns, and provide resources related to crisis and natural disasters. The Iowa Concern Hotline will increase staffing to offer 24/7 stress assistance counseling to producers in all North Central region states. Our Key Network collaborators provide the Iowa Concern Hotline with a list of their state resources for non-Iowa callers. This way, regardless of where someone calls in from, they receive information about relevant local resources. We're also supporting some existing state-specific helplines in the North Central region, specifically in North Dakota and Nebraska. The University of Illinois is developing a regional clearinghouse website that will include region-wide resources, links to Key Network collaborator websites, and interest group related resources. The website will include information about regional assistance programs and links to research-based information about behavioral health in the agricultural context, as well as descriptions of programs offered by our Key Network collaborators, stakeholder resources, and then relevant webinars. The National AgrAbility Program will host quarterly webinars similar to the one we're hosting today that will discuss the unique stressors and mental health concerns of agricultural producer subpopulations, such as aging farmers or veteran farmers, for example. And then to disseminate updates from the center, we're publishing a monthly online newsletter that will include updates from Key Network collaborators that will highlight a resource and then recognize a partner from the North Central region. If you're interested in receiving this newsletter, please email Courtney or me. The Central State Center for Agricultural Safety and Health at the University of Nebraska Medical Center is facilitating a support group for farm workers in Nebraska. Dr. Athena Ramos will deliver Bienvenido, a 9-week program intervention designed to increase access to and use of mental health services, reduce alcohol and drug use and other risk factors, and increase immigrant sense of belonging and participation in the community to 3 farm worker communities. The CS Cash team has a trusted relationship with several farm worker communities and will partner with the Nebraska Migrant Education Program and Proteus to expand their reach. We're really enthusiastic about this program and interested in identifying opportunities to expand Bienvenido to farm workers in other North Central region states, and determine if the support group model would be appropriate for other agricultural producer populations. North Dakota, Wisconsin, and Missouri have partnered with nonprofit and state departments of agriculture to provide stipends or vouchers for professional behavioral health services for agricultural producers, workers, and their families who often face financial barriers to mental health care, as Courtney mentioned previously. As a center, we'll evaluate these programs and develop recommendations for other states who are interested in providing these options to their agricultural workers and populations. The North Central region effort include each individual state as well as small groups to work on specific topic areas, or what we're calling interest groups. To date, many of the efforts around farm stress have been general or for conventional primary producers without specific attention to diverse groups within agriculture. The center is facilitating these interest groups, which will include at least 3 network collaborators working together to identify existing resources relevant to that interest group, develop resources where these gaps exist, and then work with their partners and connections to disseminate resources. The 6 interest groups are listed on this slide. As an example, I mentioned Bienvenido, the 9-week support group that we're offering for farm workers to increase access to and use of mental health services. We're developing programs about stressors that are specific to women producers and how to manage them. We're piloting and disseminating programs to help youth strengthen their coping skills and understand mental health, as well as programs about communication skills for farm couples. The Mental Health and Suicide Prevention Group is working together around specific programs to offer those specifically in agriculture, such as mental health first aid, QPR, and Michigan State University's Weathering the Storm program for improving knowledge about mental health and the skills to assist someone among farmers. The Agribusiness and Financial Decision-Making Interest Group is working on tools and programs to assist producers with the financial stressors, such as piloting a program pairing extension health educators with farm financial educators to assist in a farm financial assessment. And finally, the Healthcare Providers Interest Group is focusing on understanding what information providers need to better serve farmers, as well as offering training to this audience to improve their agricultural literacy. We are so appreciative to the USDA for the funding and their investment in farm and ranch stress assistance. We're very excited and honored to begin this work. We are incredibly grateful to our key network collaborators and their commitment to the agriculture producers and stakeholders in the North Central region. I want to thank you all for joining us today. And I think we've all, Courtney, Brent, and I would be glad to answer any questions and facilitate a conversation at this time.
Thanks so much, Brent, Courtney, and Josie. We are taking questions at this point. If you'd like to go ahead and enter those into the chat area, we have several there already.
The first question that came through was, did the FRSAN projects conduct any research, or is it just extension and outreach?
This is Brent. I'll take first stab, and then if Josie and Courtney want to respond. The way the legislative authority is written is these are extension-only projects. However, we did require independent evaluation of the efforts underway in each of the regions so that we could gather the information, again, about what works, what's promising, what doesn't, so that we can inform future iterations of the network as it continues to evolve and develop. Certainly, then, the research questions are viable, and again, members that are from land-grant universities that are active in this space, those are certainly topics that potentially could be explored. I know that Courtney has led some research in this area, so I'll hand it off to her.
Great, thank you. Yes, and we've oriented our North Central region efforts around the outreach components to make sure that we are meeting the guidelines of the RFA. And as Brent mentioned, we do see opportunities. We have a robust evaluation plan that we see as being really able to contribute towards the evidence base of programs that we know work or don't work for those who are engaged in agriculture. And several states, as well as the region, are planning to conduct some needs assessments to make sure that our programs are indeed serving the needs of producers in our states and in our region. So I think those overlap very nicely with research efforts.
Any other comments? Josie? Okay, we'll move on to the next question was, do all the FRSAN networks provide the same types of services?
This is Brent. Yes, they are required to, by the legislation, to provide that suite of services that we identified in the slides, and then Josie reinforced in terms of the North Central plan of work. They could look differently in each region, and again, even within regions across states, depending upon what the individual partners have identified and what expertise and capacity that they bring to their contribution to the work.
Okay. Hey, next one's a little longer question. For those of us working with FRSAN for farmers, ranchers, and ag workers to professional therapists, what records do you recommend we keep, especially in the litigious environment we find ourselves these days? Josie, you want to take a stab at it? Yeah, I see you on my screen, so.
Sure. Yeah, well, I can only speak to the North Central region, and we obviously respect the privacy and any, obviously, provider-patient confidentiality. We are mostly interested in documenting the number of, for example, vouchers that are distributed through some of our key network collaborators. We don't know for sure, what that led to, if that led to somebody entering the mental health care system for long-term or just so the vouchers expire. But our general recommendation, at least for the North Central region, is to keep very sort of high-level information as to how many vouchers were distributed annually, how many referrals were made, but we don't expect to receive any much more information beyond that.
Okay.
This is Brent.
Brent or Courtney, go ahead.
Yeah, and I'll just say, again, depending upon the region, and I provided the lead project director for each of the regions. If you're in one of those other regions, you can reach out directly to that individual and see what the guidance is that they're offering. It is going to be similar across regions. It is one of the challenges, and it relates back to that research question a larger research question is, if you're successful in obviously keeping somebody from harming themselves or others, you're not necessarily going to know that, right? And so you can't easily quantify it. So the important thing for us at this point is to identify, again, what we learn from producers and family members that help report back to us in terms of what attracted them, what allowed them to engage with the services and supports that we then potentially can cross-promote across the regions. But that is going to be continuing areas of questions and suggestions that folks have based upon their own experience working within their states or programs are certainly welcome. Feel free to send those forward to us.
Okay. All right, this was a question that came in, particularly relevant in today's situation. How are internet connections distributed among the population that we're working with?
Well, I can get us started on this. About 75% of people who live on farms report that they do have an internet connection. So that's a quarter that potentially could not. The study that information came from doesn't necessarily take into consideration data plans on cell phones, which are even more popular now. So I would imagine the percentage of people who have access to the internet is a bit higher than that. Josie or Brent, do you want to add on to that?
Yeah, I think to that point, we have to realize that similar to health insurance, there's a spectrum of availability of internet services, and so participating in a Zoom call with both video and chat may be a stretch for some internet access, and so we're working to make sure that we have resources and services delivered in a variety of different ways and not relying entirely on Zoom webinars, because we realize connectivity does not mean the same for everybody in our region.
Yeah, this is Brent. I'll just add that we are cognizant that not everyone's going to have access to the internet, so that's part of the reason telephone helplines are one of the required elements to be offered across the regions. And again, we hope in the not too distant future to be able to get back to more in-person programming. Again, when we originally posted the RFA for this was before the pandemic was on the horizon for us. And so credit to our teams across the respective regions for being able to start to stand things up while making the transition to more of an online delivery format. And we know there's going to be lessons learned there. But again, the goal here going forward is to be able to offer a suite of services that would allow folks, again, depending upon their access and adoption of broadband or e-connectivity, to still be able to engage with the networks.
Okay, you Wilson. Okay, that is all the questions that we had on the slides. But I know I had a couple more come in that I can't access with my screen being shared. So let me.
I can read it, Ed.
Okay, you're a panelist, so.
Yeah, there was a question. Are you adding folks into your help or focus groups? For instance, I'd be interested in helping with the financial assistance or women producers groups.
Yeah, I would say reach out. I think contact Courtney and I. Our emails are there on that screen, and that's something we can certainly discuss.
And Ed, that's the only other question that I see that was added. There were some thank yous, and
okay. Yeah,
so we will just acknowledge that with a "you're welcome."
Very good. I think then. Thank you all. Paul, we'll turn it back to you.
Yes, I do just want to express thanks to all our presenters, to Brent, to Josie, and Courtney, and also to everyone who took the time to join us today. We had a good group and some good questions and interactions. We hope you'll continue to participate in our future webinars. Again, we will get information out to you as soon as those are available. I'm going to take one quick look through the attendance list to make sure nobody has a raised hand at this point. And I do not see other questions in the chat. Yep, just some thank yous. So again, we appreciate everybody's participation today, and we wish you a good day.